Hello, everyone. Welcome to our webinar, COVID-19 and University Response. We know this is a challenging time, and we appreciate you joining us for this webinar today. My name is Sarah Porter, and I'm the Vice President of External Affairs at Healthy Schools Campaign. Today, I'm representing the Healthy Green Schools and Colleges program, a partnership between Healthy Schools Campaign and Green Seal. Formerly called Green Clean Schools, this program leverages more than a decade of Healthy Schools Campaign's work, along with Green Seal's additional expertise, providing even more resources for creating healthy, sustainable, and effective cleaning programs. Before we begin, I'm going to quickly review some basics for today's webinar. Today's webinar will run for approximately 1 hour, and a recording of the webinar will be available to view later. We will email a link to the recording, and it will also be archived on the Healthy Green Schools and Colleges website by the end of the day. We're going to save the bulk of our time today for a question and answer session with our committee members. You can ask questions by typing a question into the questions box located on your control panel and click on the send button. Feel free to send questions through the questions box at any time during the presentations, and we will answer them during the Q&A session at the end. COVID-19 has thrust schools' custodial teams into a frontline battle with infection control and forced leadership to quickly develop and implement processes to address this global pandemic locally. The Healthy Green Schools and Colleges committee members graciously offered to share their experiences dealing with COVID-19 at their universities. The information shared during this webinar is for general informational purposes only. The experiences and information shared today are not intended to replace, directly supplement, or formally operationalize the guidance provided by the U.S. federal government, including recommendations published by the Centers for Disease Control, the Occupational Safety and Health Administration, and the U.S. Environmental Protection Agency. We encourage you to visit those federal agency web pages if you are seeking formal instruction on how to develop or update your cleaning protocols in response to COVID-19 or any public health emergency. We will include links to these resources in our follow-up email. Today's webinar is a knowledge-sharing event in which the leaders of green cleaning and building operations in higher education will share their experiences. On the webinar today, we have Jodi Krauss, Assistant Director of Housekeeping at the University of Wisconsin-Madison in Madison, Wisconsin. Christopher K. Rein, Director of Administrative Services at Cosumnes River Community College in Sacramento, California. Kimberly Thomas, Director of Facilities Management at the University of Georgia in Athens, Georgia. And Jean Woodard, Director of the Building Services Department at the University of Washington in Seattle, Washington. First, I'd like to introduce Jodi Krauss from the University of Wisconsin-Madison.
Hello, everyone. My name is Jodi Krauss. As Sarah shared, I am the Assistant Director for Housekeeping at the University of Wisconsin in Madison, Wisconsin. I have been the Assistant Director for about 12 years, so I do have the benefit of having gone through this some of these same practices and procedures during H1N1. Here at the University of Wisconsin, we have 45,000 students on campus. Roughly 8,000 that live in the residence halls with us, which is the area that I oversee. We also have university apartments where we house families, roughly about 2,000. Currently in Wisconsin, the number of cases hit 156 yesterday, I believe. I don't know if that had been updated today. At last count, we had 25 confirmed cases, or 25 cases rather, in Dane County. Here in the residence halls, we had 0 suspected cases or confirmed cases. On campus, there was 1 confirmed case a couple of days ago, so that person is isolating. Phase 1 for us was really campus as a whole was taking inventory on things like personal protective equipment. How many masks did we all have? How many gowns do we all have? We have a rather robust emergency group, our EOC group, that connects all 5 campus partners to determine what supplies and PPE are needed in a pandemic or instance like this. So we were actually prepping and getting all of our supplies together. It went very quickly. We actually started prepping isolation spaces before we actually got inventories done. So within the course of a day, we were trying to get inventories. The next day I came in and myself and a few other people were setting up isolation and quarantine spaces away from our residents. So our response to that was just as quickly as we could to gather everything that we would need. We needed to provide furniture, beds, linens, towels. I immediately needed to start writing policies on what our cleaning procedures are going to be in those spaces, how we were going to get the supplies that we needed. I would say our biggest challenge really up to this point has been the ability to get supplies that are needed. While we as a campus can pool our resources and share with one another, we know that there are other areas in the state that currently aren't as able to get some supplies. So there really has been quite a tightening and restriction on what everyone is able to get. Obviously, we want our hospitals stocked first and our healthcare providers. And so we have shared items with them as well during this so far. I would say in terms of, what we're learning and how to address it is really just working together as a team, staying positive, making sure that everyone feels safe, secure, following, our CDC and our World Health Organization practices, honoring what EPA shares with us to clean with, how to react to these situations. And so I think, honestly, just working together is the biggest piece. I do know that, or I can share that currently our residents are moving out. Our school is doing classes electronically starting next week, and this kind of hit us during spring break. So we have unfortunately had to ask our residents to start coming back to move out their items now. And I know that this will greatly impact our summer conference program as well. As far as staff, essential staff are here on campus. Other staff have been asked to work from home, telecommute if they are able. If they are not able, unfortunately right now they need to be at home. And we are trying to figure out how as a campus we can continue to support them. So we have daily updates on our campus from our chancellor, from our alumni association, from our health services, from the governor, all of those groups. So it is definitely interesting trying to stay up every day what's changing. Sarah, you had asked about how the campus operation of the university changed and how does it impact what we're doing. Honestly, it really is a skeletal crew here on campus, and honestly, trying to just figure out right now, our biggest challenge is really how to support staff, both the staff that have to be here as essential services or the staff that have been sent home, how to set them up to telecommute, how to financially support staff that are unable to work, be it because we've had to let them go home or their kids are at home with all of our school districts, across the state have closed for the duration. So I'm not sure if there's other more specific information. All of our K through 12, as well as our colleges, are educating online beginning this week and next week. So it's kind of a learn by day experience for us.
Thank you, Jodi. Thank you for sharing. That's definitely helpful to hear. Appreciate it. Next, I'm going to introduce Chris Rein from Cosumnes River Community College in Sacramento, California.
Good morning, everybody. glad everyone could be here. I hope everybody finds some good information out of this. My background, I have 21 years plus in facility maintenance. As my title says, currently the Director of Administrative Services / Facilities for Cosumnes River Community College. I have a staff of 23. My college is part of a four college district in the greater Sacramento area. My campus serves about 14,000 students and about 1 million square feet. Our current situation in California right now, if anyone watched the news last night, California is under the strictest shutdown in the nation as of this morning. I haven't checked anything recently. So I've been at home remoting in and trying to do work from home, which is it's very challenging for a facility person to try to work from home when he's used to being at a physical plant. The number of confirmed COVID-19 cases in California are 971, with 19 dead and 6 recovered. None so far have been reported on our campus, but with little to no testing, that more than likely will change in the coming weeks. It's just the nature of what this will be. It's sort of like an iceberg out there. You sort of see a tip of it, and there's more to come. Our response during the phase 1 was really focused. For me, it was focused on the custodial staff. It was a refresh of blood-borne pathogens training on PPE and what they needed to do, and how they were to be spraying and what they needed to be worried about. The touch points was the main focal point. Washing their hands as often as they could, those type of things. Education to the staff and the faculty and the students of what custodial are doing. It was an interesting process. We felt we could never really get ahead of the ever-changing nature of what was going on. So it was pretty interesting to try to keep everybody calm, but at the same time, it just kept rolling in. And that was our biggest challenge with this entire process, was trying to educate, keep everyone safe, and then as it slowly morphed into, we're going to be shutting down the campuses to faculty and staff. And now we're shutting it down to just essential staff. And then the essential staff went from probably 100 people to 5. The custodial department was even told to stay home. We will clean on the back end of the crisis, not the front end, to keep them safe and out of the harm's way. So there has not been any custodial staff on my campus since Tuesday evening. Was the last time we had any support staff. We are doing very limited once a week services for receiving of packages and federal mail, and everyone has to have basically written permission from the Vice President of Administrative Services to enter the campus at this time. That's the key thing, is trying to keep everybody at home and away, and let this thing run its course without getting any more people affected than we can avoid. That is all I have right now. Sarah, would you like to answer the question, or wait?
No, I think that you shared so much right there. And is there anything else in particular that you would want to share at this moment about how you're supporting staff? You've already said so much.
Supporting the staff, my administrative staff, we're doing a daily check-in each day just to see what we're getting there. And it's just really on my side of it, it's the supporting of the staff is really those outside of campus operations, assisting the vice president on, coordinating people who were set up to have a virtual personal network at home, shut their computer off. Someone needs to get back into the campus to turn their computer back on at their desktop. Still building a new building on campus and coordinating questions with contractors on how design pieces are supposed to be. Those are the support things that we're really trying to do. And, the extra laptops and webcams that have been bought, and the personal Wi-Fi network pieces that we bought for some staff who didn't have Wi-Fi at home, all those pieces that hadn't arrived yet, coordinating how to get those mailed to their home so we don't have to have people come in. One of the pluses that we have had with the district is from full-time help student help and temp classified help, everyone is still continuing to getting paid by the district through the shutdown. So if you had a set schedule as a temp classified, you work 3 days a week, even though you're custodial and you're sitting at home and not doing anything and you can't work from home, you're still getting paid your schedule that you already had in place. That can potentially change over time, but in the here and now, no one's been impacted on pay, so they don't have to worry about additional items than what we're already dealing with.
That's remarkable. We know that not everybody is in that situation, obviously. So that's really great to hear from your end for the time being. Thank you, Chris, for sharing all of that. Next, I'd like to introduce Kimberly Thomas from the University of Georgia in Athens, Georgia.
Well, good afternoon, everyone. And just like to share that, as mentioned, I'm Kimberly Thomas. I'm the Director for Facilities Management. My two specific areas are the Work Request Center and the Warehouse and Supply Materials Department. And as far as Athens, Georgia, we're about 60 miles east of Atlanta. We're the smallest county in the state, but one of the largest universities in the state. Our institution is public, coeducational, student enrollment of about 37,000. We have a workforce of about 10,700, and our FMD, facilities management workforce, is roughly 960 employees. We have about 345 buildings on our campus, and we have a really diverse community. Right now in Athens, we've had 2 confirmed cases on our campus, one a student, one a staff member. The student is back at home outside of Athens isolating, and our staff member is isolating. As far as Athens Clarke County, we've had 8 confirmed cases, and our local government has already instituted a shelter-in-place ordinance as of last night. And that's really because we have about 50 ICU beds available from our 2 local regional hospitals. So with Athens being purely a college town, but serving so many of our local counties surrounding us, we really are paying close attention to making sure people do what they need to stay home. And that includes on our campus as well. As far as Georgia, as of 12 noon today, there have been a report of 420 cases of coronavirus with 13 deaths. Yesterday, it was 287 confirmed cases with 10 deaths. And just this past Wednesday, it was 197 cases with 3 deaths. So you can see that, unfortunately, we are having those numbers really increase, and in part because we have just recently had a local drive-through testing service become available. So we do expect those numbers to unfortunately rise. As far as some of the responses that we've done on our campus, we've been working very hard with our FMD team from our other custodial department, grounds, project management, and our operations and maintenance staff and our senior leadership to ensure that we have an adequate emergency stock for the things that we need to do. Of course, our students, just like Jodi has mentioned and Chris has mentioned, have already been given the news that they will not be coming back for the remainder of this semester. We have worked hard as senior leadership to be able to speak with one voice and to let people know, as of just yesterday, there will be no commencement. The spring athletic, other types of campus events have all been suspended, canceled. So nothing is going on. We're trying to hopefully ensure that people stay home and that we can help support our medical and emergency responders. But what we have been doing on campus is to ensure that we do have plenty of stock to support the ones that do still need to work, our essential staff and our maintenance, our custodial staff, our emergency responders on our campus, as well as our research lab professionals who still may need to work, as well as our health clinic staff who are in support of our international students and married and family housing residents who could not leave the campus, as well as our vet school. So we've had plenty of conversations to try to speak with a consistent voice to allay fears, to ensure that our insurance providers have the conversation around how to take care of our staff. We know that a lot of our staff are at home who are non-essential, like our faculty members, other administrative staff, and they're taking care of their kids. And so to ensure that our central HR is communicating with them to allay those fears and make sure that those people get the information they need so that they feel comfortable about work. As Chris mentioned, we are teleworking as much as possible. And as far as some of the challenges, I've learned that there's definitely a fear factor. That was one of the first phase 1 type of things. But as a leader, just having to make sure that I ask the right questions and ask every question that I need to ask for myself and for my staff so that I can share accurate information. Reaching out to other professionals across my campus, across my local community and the country to know that they also are encountering similar issues, but maybe to gather some feedback that I can use on my campus. And that has been helpful to bring back some ideas to help us understand and to be able to share the best and the safest information. Some of the other challenges as far as what we're doing on our campus with our custodial staff is, implementing the plan. As Chris mentioned, the same thing, not rushing in when we do have confirmed situations, but giving ourselves a 24 or even a 48-hour period where we can have our staff be safe, and when they go into these areas that they be safe. And we're using our blood-borne pathogen procedure. So working with our distributor to come up with ways that we can refresh the training, the safety training with our staff has been key, as well as ensuring that we shared that information with our housing staff, our health clinic staff, and others around campus so that they felt comfortable and using the approved CDC products with regard to how they handle these issues. So I look forward to questions as you have them.
Thank you, Kim, for sharing all that. And I love what you said that, one of your challenges and sort of how you're addressing it is as a leader, how to make sure that you're asking the right questions. And you said so much about reaching out to your peers and folks in other institutions and asking questions and getting feedback and learning from others about what you can do as well. And that's absolutely the goal of today's webinar. So in that spirit, I just want to mention a quick reminder for folks. We've got Jean Woodard coming up next, but in the meantime, please continue to type any questions that you might have into the question box on your screen. After Jean is finished presenting, then we'll move to our Q&A section of the webinar. So last but not least, I would like to introduce Jean Woodard from the University of Washington in Seattle. Jean?
Thank you, Sarah. Good morning, everyone. I've been with the University of Washington for 34 years. We've had earthquakes, we've had fires, we've had chemical spills, we've had all kinds of events during my time at the university. But this is the first time where building services is on the front line. We're the edge of the spear in keeping the campus safe and restoring confidence. Seattle is the epicenter, or what the state of Washington is. In the state of Washington, we've had 1,376 total cases. As of this morning, that number continues to climb. In the state of Washington, we've had 74 deaths. Many of them, approximately 20 of them, were associated with the nursing home in Kirkland, which is just 5 or 6 miles away from the Seattle campus. In King County, we have 693 total cases, 60 deaths. King County is the county that the University of Washington Seattle campus is located in. And we've had 20 confirmed cases. The University of Washington has 3 separate campuses, one in Tacoma, one in Bothell. I'm responsible for the cleaning of the academic, research, and administrative places on campus, about 175 buildings, 11 million square feet. We have a little over 300 staff in both the units within building services. Custodial has by far the most. And then we have UW Recycling with a team of about 15 people. So this hit like an avalanche about 3 weeks ago on a Sunday when I was on a conference call with my vice president and my immediate boss, because there was a case, a confirmed case in one of our leased buildings a few blocks off campus. They vacated or emptied the building. We don't service that particular building. That's under a contract. But the landlord decided to hire a contractor, and they went in and sprayed mist, and I'm not sure exactly all that they did, but they brought in an army of people and charged an exorbitant amount for cleaning. So one of the first things I wanted to do was start researching what were the King County Health Department's recommendations, what was the CDC recommending in terms of cleaning, what was our Environmental Health and Safety Department recommending, and I started working with them to help develop the cleaning protocols that align with the recommendations. I didn't want us to go overboard on things. I immediately started researching how the virus is transmitted. We know that the primary transmission route is through droplets. The virus is carried in the upper respiratory system, so these droplets can go out 3 to 6 feet. They're pretty heavy, so they do settle on horizontal surfaces after 3 or 4 hours. So I wanted to know all this about the particular transmission routes so that I could have facts to share with my team. We are an essential service. The University of Washington never really closes. There's research that's taking place around the clock in a large number of our buildings. There's other programs that the community is relying on the campus. So our staff have been coming to work, and one of our biggest challenges was to help reduce that anxiety of them possibly being exposed or in harm's way or having a possibility of contacting the virus. So I had to assure my administration that we already cleaned as if anything was contaminated. We used universal precautions. All of our staff have been trained in blood-borne pathogens. We use a hospital-grade EPA approved disinfectant, and we looked at the CDC list. They actually have 2 lists of approved products for the coronavirus, and the disinfectant that we use is on that list, so that was assuring. So we've been reinforcing all the common sense and ways to protect oneself. We've showed videos on proper hand washing to our staff, and then how to prevent chafing, and because I've learned that although we practice good hand washing, we weren't doing it extensively and properly as recommended by the World Health Association. We began practicing social distancing, trying to keep a distance of 6 feet from our staff, which is really a challenge when clocking in and clocking out time. We've put tape down on the floor at our clock-in stations at 6-foot intervals to give people that distance. When we do have to attend a meeting physically, we're meeting in large auditoriums so people could spread out. I've been bringing in an occupational physician to help confirm that what I was saying and what we were telling our staff about staying safe was the right practice. So we're essential, and we've been coming in. We've had to respond to about 15 special requests for cleanup where a positive case, where the person spent a significant amount of time in offices, in classrooms. The CDC recommends gloves and a gown, the gown primarily to protect oneself from the spraying of the disinfectant. We did acquire some electrostatic sprayers. We were able to find one, but we purchased some paint sprayers that actually worked, spraying a fine mist of the disinfectant in these large spaces that we had to totally deep clean. So obviously clean first, then come back and disinfect a space, mark that room as clean. We developed signs so that we can indicate that we have totally cleaned the space. Also, I developed a 3-week plan. On March 6th, all classes were suspended, our in-person classes were suspended, and everyone went to online teaching. So we thought that perhaps spring quarter would start on March 30. Spring quarter will now be extended, or the online teaching has been extended through the spring quarter. So now that 3-week plan has now become a 6-month plan, because we'll really have through the the beginning of fall quarter, because our summer activity the population goes down. We have about 44,000 students, and in the summer it's down to just programs and special events and more conferences. So the anxiety of our staff, we really worked on them to ensure that they were safe. Right now, I'm really concerned if the state of Washington does what California does and goes on a lockdown. We've had very liberal sick leave practices, and many of my staff earn and burn sick leave as they accumulate it, and many have less than 40 hours of sick leave. We're also checking to confirm how many have at least 80, because if someone was asked to be quarantined, that's 80 hours of paid time that they can use. The university has or will grant administrative leave if someone was confirmed to have contacted a positive case here at the campus. Our med centers are really under pressure. We have 3 hospitals. They've reached out to me to see if I can avail my staff for overtime to work in non-patient areas at those hospitals. So now that we have less time constraints or more time, we're going to be looking to see who amongst our staff would want to work overtime. So there's a whole lot going on. This last 3 weeks is probably the hardest I've worked in quite a while, just in communicating what we're doing. We made a video earlier in the week that we're getting ready to release to describe what we're doing in terms of deep cleaning and enhanced touch point cleaning. We had a conference with all of our building coordinators yesterday, a Zoom conference, and I shared a lot of information with them. As of today, all buildings on campus are secured. They will not be unlocked. So we've been working with all the departments who still are doing business and still have employees that must be on site, and making sure they have access and deliveries to campus. So it's just an avalanche of activity. Today I've been meeting with my senior leaders in my department every day, and I've really stressed to them to find the things that they can do to relieve stress, to give them peace, to turn the news off. And I had each of them describe what they were going to do this weekend to relax and to decompress, because it's been pretty high anxiety. The world has changed just like that. Restaurants are closed, schools are closed, no gatherings of people of more than 10. So our life has changed, and that's the case throughout the world. So that's what I have for right now, and I look forward to answering any questions.
Jean, thank you for sharing all that. You are certainly at the epicenter of this, at least in the U.S. And I really appreciate what you just shared at the end about how, one of the main things, well, I mean, you've said it repeatedly, but really focusing on the sort of mental and emotional health and wellness of your staff, and really encouraging them to kind of tune out and shut things down for a while and focus on their families and their health, which I think just is a really important thing for all of us, but also just really speaks to the kind of leadership that you have always provided. So appreciate everything that you've shared. And thank you all of our committee members for everything that you shared with us today. We're going to move over to our Q&A session. To help us with that, we have Mark Bishop, another committee member, who is going to be directing the questions during this session. Mark?
All right, great, thanks, Sarah. I'm just going to jump right into it because there are a lot of questions, and I'm sure more will come in. So I'm going to start with probably a very significant, but hopefully a very quick one. This is for everyone, Sarah and my panelists. Will you be able to share any enhanced protocols that you have documented, the video that you did, Jean, and any documentation about your procedures related to your enhanced cleaning for COVID-19? And Sarah, will you be able to get that out to the participants?
Yeah, I'll jump in here and answer this one and just say that so far, all of our committee members have been so generous in sharing everything they've been doing with us, and the Healthy Green Schools and Colleges program will make sure to not only include a lot of those resources in our follow-up email, but make them available in the blogs that we're posting and on our website as well. So we'll do the work of sort of curating those links and resources and continuing to share them as best we can.
And Sarah, I could.
Okay, great.
Jean, did you want to add something?
Yes, the video will be accompanied by a article, and it's in the process of being the final edits at it, and it will be, I believe it's going to be on YouTube. So when it's posted, I can let you know and provide the link to it.
Perfect, thank you. Back to you, Mark.
Great. Great, thanks. Jean, I'll continue a question to you. There are a number of questions about your creative use of paint sprayers. So I'm just going to list a few. One, was it airless? What size tip did you use? What type of product did you put in it? What was the dwell time for the product? There are a number of questions there, so if you can talk a little more specifically there.
Oh, wow.
And how did you come to that?
Well, we had some large classrooms where one of the students had spent time, and we were concerned about repetitive motion. We have a participatory ergonomic program here, and we use a quaternary ammonia product with a 10-minute dwell time. And one of my team members actually did the research, and I might have to follow up and provide the brand name, but there's a nozzle, I believe it's a 5-gallon, and it's actually, we have one that's a backpack, and it's a household. It's designed for painting, but it really comes out in a fine mist so that it wouldn't damage any electronics or anything like that. But we avoided the audio equipment in the classrooms, but it was mainly for wide areas. And I can provide the specs later. I don't have those with me right now.
Okay, great, thank you. Let me jump to Jodi. How were your cleaning workers? Did you have adequate cleaning workers? Did you have to rely on any outsourcing during this crisis?
So far, we have not needed to rely on any outsourcing. For myself, on day shift in the halls, we have over 100 staff, housekeeping staff. And then our night shift has 20 housekeeping staff. So we've actually relied on that staff to do the disinfecting, which we actually had to add to our program. We stopped using disinfectants a number of years ago in our regular program in lieu of a more environmentally friendly sanitizing program. So we had to reintroduce disinfectants. So we use the 120 current custodial staff and leads that we have, and that those are the folks obviously that are in housing. I know that we have throughout campus, obviously each of the 5 campus partners has their own custodial staff, and so that staff so far has been essential to campus, but in housing for sure, because we still have residents living with us.
Okay, great. Chris, question for you. Are you cleaning areas when staff are present, or are they all unoccupied areas?
Well, currently they're all unoccupied because the district is completely shut down. But wrapping up before that, we were cleaning as we're going along. So if you walk through the library doors, once every hour someone was coming through, grabbing the doors, doing the restrooms, just doing the touch points. We cannibalized some people from the graveyard shift onto days to try to it was part to help, also just to get visual out there so people could see what we were doing. One of the challenges that we had was people were questioning what we had done. When you're doing it at night when no one can see it, they're not really believing if you're doing it. So getting some people out where they can be visually seen doing what we're already doing helped alleviate some concerns. But we just, we put some signs up, cleaning and just clean because it was the best thing to do.
Okay. Thank you. Kim, I'm going to jump to you. You mentioned that you're using your blood-borne pathogen procedure. 2 questions related to that. One, are you using your blood-borne pathogen? I guess point 0 is, will you share that? But point 1 is, are you using that for all cleaning now, or are you just using that for focus areas? And second, related to that is, are your staff using PPEs, and what type, if so?
Well, point 1, yes, we would be willing to share. And point 2, we are using this kind of as a standard. We worked with our distributor to ensure that we refresh the training and we refresh the practice, and making sure that we implemented the CDC approved disinfectant, because we have a green cleaning program and we wanted to definitely ensure that the product that we were using met all of the requirements based on the CDC approval. And so we ensure that we wrote that into our new training specs, and that's what we are working off of. And what was that third question? I'm sorry, I didn't catch the third part you asked.
About personal protective equipment.
Oh yeah, and so we are using our standard, our gloves. We work with our health and safety, F&D. We have our own safety department. So as far as we have a core team, we call it a strike team, and they got additional training along with our health and safety officers to have a higher level of safety apparel. And I'm saying it very carefully because I know that there's a lot of concern about the limitations around the N95 and 99 equipment, and trying to procure those and trying to save those for our medical and emergency responders who need that equipment. But we were able to get a few of those for our strike team and gave them higher level training. And so that's one of the reasons why we went to a wait 24 to 48 hour approach, so that we would give our team time to really, when they go into these areas, focus on our hard surface cleaning and give them an ability to have a little bit more safety cushion when they go in and clean these areas.
And then what type of disinfectant product are you using during this cleanup process?
If we were, I didn't know if we were going to be talking about the name of the brands, but we use the BioS.
What is the active on that product, which I don't know?
The active is Thymox.
Is it a cloth base?
It's
Thymol?
Yes, and I can send that to you. It has a 1 minute coronavirus kill.
Okay, very good. All right, let me keep asking some more questions. This is something that I have not heard. I'm going to address this to Jean. There seems to be some companies telling regular cleaning services that COVID-19 is a biohazard, and you should not attempt cleaning up. I'm addressing this to Jean, but I'm not sure if you've heard this. Has anyone heard this before?
I have not heard that. It is a primarily respiratory droplets situation. There's been a variety of studies to show, the cases that they can't trace to someone's travel or being exposed to someone else, they are assuming that those people probably touched a heavily contaminated surface and then may have put their hands in touch their eye or touch their nose or touch their mouth. But in terms of a biohazard, there's nothing to actually clean up and see. We don't see this, so it's basically it's disinfecting, and we know that does kill the virus if you use proper techniques and approved chemical and the dwell time. I've just not heard that.
Mark, this is Chris.
Okay. Yes, Chris.
Similar, I haven't heard it, but the standard that I would operate on is what Custodial does. If it's a biological, it is a hazard in nature. So if it's not something that is yours and you're cleaning it, treat it as a biohazard. So to say that you shouldn't be cleaning a biohazard is, I think, is a selling point. And I have alarm bells if someone were trying to sell me that.
Yes, and in our staff, as I mentioned, we use universal precautions. So we assumed everything is a hazard, and certain things we know we dispose of in different bags, and blood-borne pathogens and body fluids. We're using our universal precautions, gloves, proper hand washing. The waste in the room we dispose of in our normal waste streams. So there hasn't been any direction from any of our health counties that this is there's special precautions other than what we're taking that are required.
Okay. Let me address another question. I'm going to open. Yes.
Oh, this was Kim. I was going to say, and also wanted to add as far as with the face mask, and we use boots and goggles. if need be, depending on what that situation requires. So I wanted to throw that in as well.
Yeah, a source of anxiety that we've been addressing is, the quat that we use does not require respiratory protection like a face mask. We have a project crew that has received additional training, and we're getting some pushback. Staff want N95s, but there's nothing requiring that. And so that is one point of tension that we're still trying to work with and assure our staff that we're not sending them into rooms that have known cases until well after 24 hours. Most of the cases occurred, the person was last on campus on March 6th or 7th, and they developed symptoms on the 12th. And then, we're notified on the 13th. So that person hasn't been around for a while. And so there's the N95s aren't really effective against the quat or the virus itself in that particular case.
Oh, and one last thing, I'll chime in, and then I know you need to move on, Mark. But we're notifying our FMD, our safety personnel, so they are kind of like our own scene type of just safety check to make sure all of our protocols are being followed. If there's any additional issues or concerns, they're right there with our custodial staff as well to ensure that everything is handled properly, disposed of properly, and they're creating a report, a record of what takes place.
Okay, great. Let me, one of the things that's been coming up as a question is a question of dwell time in two areas. First of all, a lot of interest in identifying what you said, Kim, about a disinfectant with a 1-minute dwell time. So I think if you could share afterwards, share it with Sarah, who can then share information out about what that product is. I think there would be a lot of interest in learning more about that. And then on the flip side of that, there is a general question of, I have a product that has a 10-minute dwell time, 5-minute dwell time, 3-minute dwell time. How do you handle these dwell time issues based on your different methods of distribution? And I want to throw that out. Do any of you have any way to answer that?
So this is Jodi. I would say honestly, like for us with our custodial staff and the training, it isn't uncommon for disinfectants in particular to need a 10-minute dwell time. So there are other, when it's a spray, right? And so there are other ways to use disinfectants or disinfecting agents that don't require that long a dwell time. So for example, Clorox, like if you are using a disinfectant wipe, ones that are on the EPA's list, either a Clorox or a Lysol disinfecting wipe. For us, because we're in bathrooms where our residents are still living and we may not be able to let the disinfectant spray or ready to use diluted form sit for 10 minutes because the residents need to get into that bathroom, we have a tendency to use the wipes so that is a quicker way to be able to clean that space. But where we can let it sit for the 3 minutes, 5 minutes, 10 minutes, that's required depending on what you're using. Of course, we then, in those less commonly used or heavily used areas, that is what we do. I'm not sure, Jean, Kim, Chris, if you guys approach that differently.
Well, this is Kim. In our program, we're not using the wipes. Just with our regular standard program, I mean, we have dilution control centers in our facilities that we're using, filling up our spray bottles, and we're using microfiber cloths. Any of the areas that we have been identified as those that are contaminated or have a higher level of cleaning necessary, then we're going to the disposable types of wiping materials, and those are all disposed of. Those are not going to be cleaned with our microfiber cloths. But as far as with the dwell time, that's just part of the training and the practice for whatever the particular product that they're using area.
And this is Chris. Similar with Kim, our practice is that where we don't have residents, so we'll shut a restroom down during the day and clean, and no one's in the restroom until we're done cleaning, and whatever dwell time we need is achieved through that practice. Or at night when no one's around, then the restrooms are more thoroughly cleaned that way too.
Okay, great. For Jean, what is the reason for the 24 to 48 hour wait time before you go into a confirmed case area?
The reason for that is that the research shows that the droplets could linger in the air for 3 to 6 hours. And so the recommendation is to open up windows, increase ventilation if you can, and let the droplets drop to horizontal surfaces. So then when your staff enter, there's less chance, hopefully no chance, that they will inhale any of the droplets that are still in the air. So that is the primary rationale. And that is one of the things that has assured my staff when they're going in to clean space that is positive, that it's very low risk of them contacting the droplets.
Hey, Mark, if I could add something to that, and knowing that we
Absolutely.
currently in Madison at the university don't have any confirmed cases within our halls. I'm involved with setting up quarantine and isolation spaces as well, which we have had to use for suspected cases here in the area. And we have gotten that information as well from our campus health services, state and county health services, and departments as well, that if there's any way that we can wait for 24 hours to go in to clean a room or service a room after the occupant has left, that is our best step at this point. And so we had added that to our procedure for those cleaning areas as well, as that we won't be entering until at least 24 hours after that space is available.
And Mark, if I could add,
I know that we're about, wait, sorry, Jean?
I was just going to add that.
Or Chris, who is that?
This is Jean, I'm sorry. We
Go for
will, there's pressure to go in and clean a room right away, but we have stuck to that particular guideline, and we let our environmental health and safety steer the protocols that we work with. So we don't work with the building coordinators on this. We work directly with EH&S and follow what their standards and agreed upon protocols.
Great. Okay.
Thank you,
Sarah,
everyone.
I know we're jumping over time. Can I ask people for one more quick question, Sarah? I'm going to ask you permission. I want to ask the panelists a quick question.
Make it quick.
Is it okay? You can
go ahead.
The question is, and again, your answer has to be quick, guys. You all get one bullet point. Your younger self, as in 2 weeks ago, what's the one thing you would have told yourself that you wish you knew 2 weeks ago or 4 weeks ago that you didn't, that you learned on the job since?
This is Chris. Have more PPE equipment
Kim.
and hand sanitizer on hand.
Yeah, definitely to maintain a quicker stop to get to my PPP emergency, not just for myself, but for my key counterparts on the campus.
Okay. Jodi.
I would be telling my younger self exactly what I tell myself every day. Stay positive, stay calm, stay there for your staff.
This is Jean.
Jean, younger self, go.
Younger self. The main thing that I've learned that this type of situation requires excessive amount of communication, both up, sideways, and down. And the leadership, you need to be present. And so I've really been hands-on. And so it's still ongoing. I think I'll be better prepared to answer this question when we're out of the situation. But I just know the importance of leadership at a time like this.
Okay, great. Thank you, Sarah. Thank you,
Thank
everyone.
you. Yeah. Jodi, Chris, Kim, Jean, thank you all for sharing. Mark, thank you for your help. We also want to thank the sponsors of the Healthy Green Schools and Colleges program, especially Platinum Sponsor Diversity and all of our supporters. Thank you again, all of our speakers today, and for making time for this important discussion. Thank you all for attending, and please contact Deanne Glosser, the Program Director of Healthy Green Schools and Colleges, with any questions. She was not able to join us today, but her contact information is here on the screen. We will be using some of the themes that emerged from today's webinar to inform our webinar on March 26th, which will be COVID-19 school response and operation. I can't do it today, man, guys. CDC guidelines. Oh, goodness. This webinar is for both higher education and K-12 schools. Please join us if you can, or register if you want to be sure to receive the recorded webinar. And just a reminder that we will be sending out an email with a link to the recorded webinar from today, including links to several other resources, both that we mentioned earlier from some of the federal agencies and additional resources for some of the things that the committee members have talked about today. So again, thank you everyone so much for your time. Be well, and we hope to see you, have you join us in one of our other webinars next week.